Well, welcome to this talk, and I wanted to give you an update on the coronavirus, which is in the news. Now, there's quite a few things we don't know about this virus, but there's quite a few things we do. So I thought I wanted to talk about that, and I want to tell you about some practical implications as well, how you can protect yourself, how you can protect your family, and this will be interesting if you're a healthcare provider, healthcare professional, or if you want to be a better informed member of the public who wants to protect themselves. So these are electron micrographs of the coronavirus, and they're remarkably small. This is an electron micrograph, and it's called a coronavirus because of this crown-shaped appearance, because of the outer protein coat on it. So I've run up a few notes that we can think about to try and start thinking about this coronavirus. So coronavirus, CO, corona, V for virus, coronavirus. Now, really it's coronaviruses. There's lots of these viruses. And it's a large family of viruses that cause illness ranging from the common cold to more severe respiratory disease. This is in humans. Now, the coronavirus, as we'll see, comes from animals. And in animals, it causes a lot of different pathologies. But from now on, I'm just going to be talking about the disease states as it affects humans. And of course, as it's spreading from China at the moment. Now, we've known about quite a few coronaviruses for a while. But a new coronavirus was identified in humans on the 29th of December 2019. And it was a novel virus. It is new, it hasn't been seen before. So for that reason, this virus was assigned this name, 2019 novel coronavirus. So 2019 nCoV. That's what it means. The novel coronavirus discovered in 2019. And what it does is it causes human respiratory viral infections. So we're talking about infections of the respiratory system. Now, of course, we can have upper respiratory infections in the nose, the pharynx, depends where you count. Normally upper would be above the level of the larynx. So upper respiratory infections and lower respiratory infections, bronchitis in the bronchial passages and infections lower down in the lung fields in the alveoli. These are all respiratory infections. And respiratory infections can be caused by bacteria or viruses. And of course, these ones are caused by viruses. This is a coronavirus. But there's a wide variety of viruses can cause human respiratory viral infections. So the common cold, for example, is actually different viruses can cause that. A coronavirus can cause common cold type symptoms. But the most common one is called a rhinovirus, rhino for the nose. And we get this characteristic irritating runny nose and general malaise and the features of a common cold that you're all familiar with. Or influenza is another type of respiratory virus. This causes flu. So it's an influenza virus. There's different types. But this is the main cause of seasonal flu, the flu that we get more of every winter. And there was a quite outrageous outbreak in 1918, 1919. In the West, we called it the Spanish flu, and it killed about 50 million people when a virus mutated. And when the virus mutated, this effect called so-called genetic shift. The virus shifted. It was a new genetic form of the virus. And what that meant was it expressed different proteins. And these were proteins that our immune system was not familiar with. So we didn't have immunity to it, and it caused severe illness, inflammatory reactions, and it killed young people and old people tragically. So different viruses can cause human respiratory viral infections. But thinking about the coronavirus particularly is what we want to focus on, because that's what's new. We've had these other viruses for a long time. Now we've got this novel coronavirus. Now, the coronavirus is single-stranded RNA. It's a ribonucleic acid virus. And it's in a protein envelope, and this is a protein shell or capsid. So we've got this genetic material in the middle. So if we could see it here, we'd have strands of RNA in there in the middle, and this that we see outside is the capsid, the protein envelope or the protein capsule. And we'll see that this is very important for spread later on, because this can protect the virus when it's outside of the body, and it can survive on surfaces for a few days because of this protein envelope that surrounds the RNA. And they're very small. Well, we've seen the crown shape. They're very small, 100 nanometers. 100 nanometers. So that's a tenth of a micrometer. So on this scale, a micrometer would be sort of about this kind of size. That would be the size of the smallest bacteria, and a red blood cell would be 7 times the size of that. So we're on absolutely minute scale here, only visible with the electron microscope. And an individual particle is called a virion. So this is a coronavirus virion. This is another coronavirus virion here in this picture, with the RNA inside, and this protein envelope or capsid round about the outside. Now, coronaviruses are zoonotic. It's one of the zoonoses illnesses. Now, the zoonoses illnesses, as the name sort of implies, are infections that we get from animals. So this comes from animals. And you might have remembered previous infections of coronavirus that have caused pandemics that have gone around the world, infecting the world. So an epidemic is a large global outbreak. An epidemic is a large local outbreak. A pandemic, all of the world is affected, a pandemic. So MERS was the Middle East Respiratory Syndrome. That was a coronavirus in 2012. And severe acute respiratory syndrome, the SARS in 2013, were also coronaviruses. And now we have this novel, previously unidentified one, the 2019 novel coronavirus, which is currently causing illness. Now, what are the clinical features that this novel coronavirus will cause? Well, the data from China is somewhat limited at the moment, but this is the latest data as of a couple of days ago. So the people that got this condition, 98% of them had a fever. So basically everyone who had this disease had a fever. They were pyrexial. So what happens here is that toxins are released from the virus. That's detected by the immune system. The immune system facilitates prostaglandin mechanisms in the hypothalamus, turns up the set point of the hypothalamus, and then we feel cold and shivery. We can have these rigors. Rigors is the cold, shivery feeling, because when your temperature's going up, you feel cold. That increases the body temperature and gives us the fever. Now, this is actually a good thing, because the viruses are less comfortable in pyrexial environments, and the viruses don't replicate as well in a fevered patient as in a patient with no pyrexia. And as well as that, the increase in body temperature increases the efficiency of the immune system. So we need to see fever as an adaptive defensive mechanism that's going to help us combat this infection. But it's a clinical feature that we can detect simply by taking the patient's temperature. 76% of the patients so far analysed who've been affected with novel coronavirus have had a cough. Myalgia is pain in the muscles. Remember, you've had flu and you just ache everywhere. You know, you start getting an achy back and achy limbs. Myalgia and fatigue, 44%. And I think it goes without saying with these infections, you just feel awful. You have general malaise. I had influenza flu a few years ago, and I just felt so ill. I mean, proper flu is so ill. You know, when you say you can't lift your head off the pillow for a while, you can't lift your head off the pillow. And I remember thinking, you know, I don't care if I die now. You know, at least I'll stop feeling this ill. You felt so sick with the influenza, and with the coronavirus, I assume these patients are feeling remarkably ill as well. 28% produced sputum, as you might expect with a respiratory virus. 8% had a headache. 5% had haemoptysis, coughing up blood. Now 3% had diarrhoea, which is interesting. So this virus seems to affect primarily the respiratory system, but also the gastrointestinal system, which is interesting. And 55% developed dyspnoea, difficulty in breathing, shortness of breath. So thinking about the complications of this condition. So severe acute respiratory infection is pneumonia. So you probably know that in the lungs we have the air sacs, which are the alveoli. So we have the air sacs in the lungs here, these alveolar air sacs. Gives us a nice large surface area over which gaseous exchange can take place. Now pneumonia is infection at the level of the alveoli. So bronchitis is going to be the larger bronchial passages, not that one there's a bronchial, not that one, but the larger bronchial passages in the bronchial tree is bronchitis. But pneumonia is actually affecting the lung at the level of the alveoli, and we get consolidation, we get fluid collecting in there. And of course, if there's fluid in there, the oxygen can't get in, the carbon dioxide can't get out. So that's pneumonia. So pneumonia is a complication of novel coronavirus. As with the other coronaviruses, that pneumonia is a complication. Severe acute respiratory infection, which is pneumonia. And also acute respiratory distress syndrome. Now, acute respiratory distress syndrome, ARDS, occurs when the lungs become inflamed. For any reason, it can be infection, it can be injury. And the inflammation causes fluid from the nearby blood vessels to leak into the alveoli. So the net result really is much the same as pneumonia. You get fluid in the alveoli caused by acute respiratory distress syndrome. And the patient will become very short of breath if they've got ARDS, and rapid tachypnea, rapid shallow breathing, tiredness, drowsiness, confusion, and they can feel faint as well, because what it basically means is we're not getting the oxygen in. So the oxygen might be coming down here, but it's not getting into the blood. So the oxygen in the blood is going to go down. That's called hypoxemia. And of course, if the oxygen in the blood's going down, if there's a hypoxemia, there's going to be a hypoxia. Not enough oxygen in the tissues of the body. So we know these are complications from the Chinese data. If we take chest x-rays, then we find that there's consolidation in the lungs, as you would expect. The areas which were hollow with air have become solid. They've become solid, they are consolidated. Now, other information that's recently been gleaned about this virus is the median duration from illness to the onset of dyspnoea is 8 days. So it seems to take some time for the inflammation in the lungs to develop. And the median time from onset of symptoms to first hospital admission in China, the Chinese data was 7 days. The time from the onset of symptoms to patients that needed mechanical ventilation, which thankfully was the minority of patients, but that was 10.5 days. Again, to me, this indicates it's taking time for the inflammation to develop. And interestingly, these patients developed a leukopenia. Now, we do see this with infections. Leuco is the white blood cells, penia is a deficiency of. So this is in the early stages, there's a leukopenia, a reduction in the number of white blood cells. But the particular type of white blood cell particularly involved in fighting viral infections are the lymphocytes. And initially there was a lymphopenia, a reduction in the number of lymphocytes. Now, traditionally, it's been said that the virus can adversely affect the bone marrow, but as well as that, the lymphocytes might in some way be used up fighting the infection. So initially they go down. Later in the infection, as the immune system compensates and develops, we would expect a leukocytosis and a lymphocytosis, an increase in the number of these. But if you're a healthcare provider, it's important to realise that a lymphopenia or a lymphocytosis can both be indications of viral infection, as we would expect, of course, because the coronavirus is a virus. Now, how is this transmitted? Well, we've said it's a zoonosis. It's direct from animals. So, for example, the Middle Eastern one came from camels. The other one, this one, the SARS, the severe acute respiratory infection, that came from a type of wild cat, I think it was. It was some sort of wild carnivore, anyway. So again, these are coming from the wild. They're coming from animals. And of course, in China, it just in the past few days, not before time, I might add, they've banned the trade in wild animals for meat, because this is where these, apart from the ethical aspects, this is where the virus comes from, because it's zoonotic. So direct from animals, the animals will be the vector. But now this virus seems to have got into humans and mutated, and it can now go from human to humans. So it's now being transmitted from human to humans. We now know this. And it's transmitted by droplet infection. So droplet infection is when you're breathing, when you're coughing, when you're sneezing, then there's little bits of moisture come out. And the viruses are shed by the respiratory mucosa, which is infected. And they're in this moisture that's breathed out, coughed out, sneezed out. So this is what we call a droplet infection. And this can go into the nose of someone else, the mouth of someone else, the eyes of someone else, into the mucous membranes, causing infection in a second subject. So in that case, animals can be vectors, and of course humans can be vectors, because a vector is anything alive that's transmitting the disease. So it's a droplet infection. This is why we say coughs and sneezes spread diseases. And over about 2 meters as well. So if someone sneezes 2 meters away from you, they can still infect you as the droplets go through the air, especially if they're sneezing and not covering their mouth properly. And we want to stop these viruses getting into the air, so we don't want to be blowing our nose like that. We want to be blowing it into a tissue. This is called catch it, bin it, kill it. So we catch the virus in a tissue, we put it in the bin out the way, and then the virus will die slowly there. Now, the other thing is this virus, if we breathe it out onto a surface, if we cough, sneeze, breathe it onto a surface, this virus can survive on a surface for 5 days because of this protein coat that we talked about. This remember we talked about this protein coat that it's got. Can't find it now, but no, never mind. It's got this protein coat that protects it. And the virus can actually go into a state of dormancy, and it can remain dormant for 5 days. And that means if you touch something, a surface that someone has coughed on a few days ago, the virus can get into your hands, and then you ever do that? Sort of have your hands around your face, or can you see all of those things? Are getting the virus from your hands into your eyes, your nose, your mouth, and that causes infection. This is why hand hygiene is so vital, that hands are well and thoroughly washed, and certainly we want to avoid putting our hands up around our face until the hands have been well washed, or indeed anyone else's face if you're a healthcare provider. So the virus can survive, so it can be direct droplet, or it can survive on surfaces for 5 days. And a fomite is anything which is not alive that transmits infection. So a surface could be a fomite. And in closed environments, it's much more likely to be contaminated. So if you're in an aeroplane or a bus or a train or a car or a small room with someone who's infected, you're much more likely to catch it, much less likely outside, fortunately. Now, what's not quite known about this virus yet, but I suspect it's going to be the case, is that people without symptoms can spread it. So what happens is you catch the virus, you then have a prodromal period. And in the prodromal period, you've got the virus, you're infectious, the virus is multiplying, but the virus hasn't multiplied enough to make you sick. So you are prodromal. You're going to get sick, but you're not yet sick. So you can be coughing and shedding the virus and still feel fine. But you're infectious. You're spreading the disease. And quite how this new novel coronavirus does this, or the degree to which it does this, isn't clear, but I think it is going to do this. So we can get spread from asymptomatic carriers because they're in the prodromal phase. And they'll go on to get it themselves, but in the meantime they can be infecting people. And different experts at the moment are saying this can be 2 to 5 days, but some experts are saying no, that with this particular virus it could be longer, it could be 7 to 14 days. We're not sure yet, but it's very likely that for a good few days people can be infected, transmitting the condition but not having any symptoms. But they are contagious. So quite how long, where it's going to be between 2 days and 14 days, we're not quite sure yet, but it will be in there somewhere. Which of course means that the virus can be spreading when people don't realise they're ill. So these devices at airports and things that are scanning for someone's temperature to see if someone's pyrexial, they wouldn't pick up these people because they're not yet pyrexial, they're not yet febrile, because they're not yet ill. So how can we protect ourselves from this virus? How can you protect yourselves and your family? Well, stay home, avoid planes, buses, trains and busy areas. Just shut the doors. Just stay home. Of course, it's not always possible. This is an ideal situation. Don't be sociable. If someone says they want to come round, don't let them in, because they may have the virus, and even if they're not feeling ill, they may have contracted the virus but be in this prodromal phase and could say, no, I'm feeling fine, I'll come and see you and have a cup of tea, but then they could infect you. They're potential carriers. Wearing good quality medical masks will give a degree of protection. That's all I'm saying, a degree of protection. And wraparound glasses are going to be important, especially if you're a healthcare provider and you're being exposed to this virus, because remember, the droplets can go into the eyes as well as the nose and the mouth. Meticulous gloves, of course, if you're a healthcare provider. Even going outside, if this disease becomes more prevalent, if there's a lot more cases, there's more cases around, then wearing gloves outside would be good, and taking the gloves off when you get home would be one way to stop you getting the virus from infected surfaces in the public space where people have been coughing and spluttering the virus over public surfaces. But meticulous hand hygiene, so learn how to wash your hands properly, both sides, thumbs, palm to palm, back to back. Wash your hands all over. It is very important. Don't trust hand sanitizers. The alcohol is probably not going to kill the virus. And avoid hospitals where there's lots of sick people. Now, it's looking at the moment like this has got about the same infectiousness as the SARS, but so far a lower mortality. So with SARS, this one we talked about before, the severe acute respiratory infection, 2013, 10% of people that got that died. Very virulent virus. So far with the novel coronavirus 2019, it's looking like the death rate is about 3%. So it's looking like a less virulent virus, but we're not sure quite how infectious and transmissible it is now, but it looks like it's going to be about the same as the SARS virus. And so far from the Chinese data, 2 to 3 people have been getting infections for every infected case. So that means it's doubling and tripling in incidence being the number of new cases. So treatment, well, it's basically supportive. We don't have any good antiviral treatments for the coronavirus. Keep warm. Now, I think, depends who you ask, different people will say different things, but I think that you get a temperature because the immune system wants your temperature to be high to improve the elimination of the virus and to improve the function of the immune system. So keeping warm, and certainly in adults I like to avoid giving antipyretics. In children it's different of course, but avoid non-steroidal anti-inflammatories and paracetamol, that's acetaminophen. But who you ask, sometimes people will say take regular paracetamol. It will certainly make you feel better, but it will lower your temperature and therefore, in my view, lower the efficiency of the immune system. Keep hydrated because there is a risk of renal failure with severe conditions. Should you eat or not? Well, eat if you're hungry. If you don't feel like eating, don't worry about it. You'll be fine. As long as you're reasonably nourished before, you'll be fine without eating for a few days. Don't force yourself to eat if you don't feel like it. It's really quite normal for the body to go catabolic when it's ill. No specific antiviral medications, I'm afraid. The Lancet at the moment says nothing has been proved to be effective. But we did say that we can have these acute respiratory syndromes. And if someone's got pneumonia or they've got this one, the acute respiratory distress syndrome, then they're not getting enough oxygen in, then supplementary oxygen would become very important. In fact, that's probably the main reason for hospitalisation, to give extra oxygen. 3% mortality. People are working on vaccines, but we don't have one yet. And in the UK, we've got some preliminary guidelines for primary care. Identify patients as soon as possible, including a thorough recent history of travel to an infected area. As the infection gets more diffuse, that could be from other areas as well as China. So get that history before we meet them face to face, preferably. Preventing transmission of infection to staff and patients, we want to do that. Telling potential cases to avoid public transport, so we don't want people coming to see us on the bus where they're going to be spreading it all over the place. Avoid direct physical contact during examination until you've got your full PPE on, your personal protective equipment. Isolate suspected subjects. Don't let them use public facilities, and getting the health protection team to clean the room and everything after the patient. If you find a potential case during consultation, leave the room, wash your hands and prevent others from entering the room until you've got full protective equipment. Don't allow the patient to share a toilet. And if transfer to hospital is required, tell the ambulance and control people. And patients need to be isolated, and the room where the patient can't be used again until it's been cleaned and cleared by the health protection teams. So that's a little bit about the coronavirus that we know at the moment. So there is this novel coronavirus. It's got the potential to become a pandemic. So far it's looking like it's quite transmissible, but it's looking like the mortality is relatively low. It looks like it could be quite a nasty illness, though. You'd feel very ill if you get this. And we're not going to have a vaccine for about another year or so. So these preventative measures that we talked about are going to be very important. So remember the mode of transmission, how it's spread, and what we can do to protect ourselves and those in our care from infection.